Today we're going to go through the week 5, which is e-learning. After you have go through the PowerPoint slide, you are required to do some activities. Let's recall what are the 8 ethical principles. These are the 8 ethical principles. Okay, so I hope you all still remember what is autonomy. Okay, so for example, you gave the patients information about going through an angiogram. What is an angiogram about? What are the benefits? What are the risks? And what can the patient expect during the procedure? So with this information, the patient will then be able to make a decision whether he still want to go for angiogram. Benefits is to do good. So nurses at all time we are committed to do good. Non-maleficence is good that can cause unintentional harm. For example, when you're doing a painful wound dressing or when you are injecting IM Pethidine into a patient who are in great distress due to the pain after she had went for operation. So all these are good because you are releasing the patient pain by giving injection or doing a good dressing so that the wound can heal. But all of these cause harm because of pain. Nurses, we have keeping our commitment because at all times we are mindful to be caring to our patient. And for nurses, we need to have a good attitude, care for our patients regardless of their race or their economic status or which country they are from. Uh, for paternalism, it's more towards the expertise. For example, the doctor decided that the mother who had to go for abortion to abort the 3 weeks old baby because the mother's life is at risk. Lastly, respect is one of the important components that we have to respect our patient regardless of their race, gender. And then nurses, we are committed to tell the truth at all times. So let's recap on the Singapore Nursing Board of Code of Ethics. Value Statement 1 says that at all times we respect our patient, individuals' values and needs. So how do we do that? We do not discriminate our patient regardless of their gender and ethnicity. So whether they are a foreign worker or they are a local, we give them our utmost care. Value statement 2 is we give our patients the autonomy by providing them with information. And once they make the decision, we will respect that decision. And one of the important things that we learn here is when you give your patient the autonomy, you also must know whether the patients do have the capacity to make decision. So whether are they elderly, if they're elderly, maybe you need to call the next of kin to come in so that they can also help to listen and also help the patients to make decision. At all times, we maintain our patient's confidentiality, so we do not discuss about the patient's case or diagnosis in the public places, like in the lift or at the canteen. Value statement 4, we preserve, respect our patient's privacy and dignity. For example, when we are doing a procedure, you need to close the curtain at all times, especially in a C-class ward. Value statement 5 is you gave the patient a safe, ethical care. For example, when you serve medication, you always abide to the 5 to the 7 rights so that to avoid medication error. Value statement 6, by constantly taking care of patient in the most competency level, so you always learn, go to the workshop to learn about the latest care, the latest nursing care about patient. So by constant continuing education and also to do research to have a better care in nursing outpatient. Value statement 7 is to promote the best interest of our patient at all time. So if you know that the patient um, is a child and you need to take care of your patient, so because the parents are not around, so you advocate at the patient best interest by waiting for the parents to come and therefore they involve them in the care. Value statement 8, always make sure that research activities are conducted in the ethical principle. So your patient is aware what she or he is going through in the research participation, allowing them to think through the whole of the research activities and encouraging them to ask questions so that they are able to verify their doubts and you are able to answer their questions. I would like you to read on this article and we will apply then we will see which ethical principle apply in this scenario. So please view the whole story. After you have viewed the whole story, I would like you to have a better understanding in this article, or in this case, in this incident, which ethical principle did Miss Narila apply? Did she apply beneficence, justice, and respect? And how about the hospital management? They have applied beneficence, fidelity, respect, justice, and veracity. And the social media reported the case. So did they add up beneficence, non-maleficence, and justice? Now let's take a look on the principle that Ms. Narila applied. She reported this case to the news that the foreigner worker was not treated fairly because the foreigner worker was seen in the A&E department with the hand wrapped up with a bandage and their blood all over the bandage. So the patient was not seen by the medical professional. So did she really add up beneficence, justice, and respect? The young lady says that she felt bad after she seen the injured man and was not seen by the hospital staff. She said that the patient was walking in a painful manner and no one seems to be attending to him. And she said that in the form of justice, beneficence, she shared this story because she wanted Singaporeans to treat foreign workers with respect and not to take them for granted because they help us to build our home, our roads and railway and so on. But what did hospital management apply? Did they apply all of this? Let's see what they say. The spokesman from hospital says that the patients arrived on 8:14 and he sustained the injury at 5 p.m. So by the time the patients go to the department, the wound had already stopped bleeding. And the patient was attended by a triage emergency nurse and also he was given a priority 3 because the the wound had stopped bleeding and he was also given first aid treatment and he was seen by a consultant 9 minutes after he was given a triage of priority 3. How about the social media? They reported the case. So have they add up beneficence, non-beneficence, or administer justice in this case? So in this case, Miss Narina explained that she had posted this in her social media because she wants the Singaporeans to aware that foreign workers should be treated with respect. And the newspaper reported that the, the spokesperson says that Ms. Narina has taken the photos without patient's permissions, and also the hospital not informing the hospital about the whole events. So the spokesperson do not encourage photo taking of the patients, as this is an invasion of privacy. What is the priority level in A&E department? We need to understand this so that we can know whether is there justice administered in this case. Is there beneficent respect applied in this case? A priority level is where the A&E departments, the personnel see the patients according to the severity of the condition. So there are 4 levels of priority. P1 is very ill patient, for example, that need resuscitation or immediate medical care. Example like shortness of breath, chest pain. P2 is classified as major emergency. Patients are unable to walk due to certain distress or symptom. Example like fracture of the limbs. And P3, which is classified in this case for this foreign worker, is known as minor emergency. So the patients are able to walk. However, the patient may have some minor injuries like bleeding. So therefore, for this case, patient is classified as P3 because patient is able to walk and the vital signs are stable and the wound dressing has also been applied for. So let's reflect on this simple scenario. If, for example, you have a cold and all the clinic are already closed because it's in the midnight. So if you go and see a doctor in the A&E, what is your priority then? It is considered as P4, non-emergency. So your waiting time to see the emergency doctor will be therefore longer. So let's go back to the case. In this, you can see that the hospital actually allowed the social media, which is a newspaper, to look through the whole of the video from 8:15 p.m. all the way to 11:57 p.m. And in this chronology of the time, you can see that the patient was in fact seen by the nurses, had the wound dressing done, and also seen by the professor, which is Professor Sell, and then X-ray was done. So the patient was indeed handled by the hospital in a very rightful manner under P3. Well, congratulations, you have finished the e-learning tutorial. So therefore, I would like you to post your answer by scanning this QR code and complete the answer for these 2 questions. Please remember that you need to write down your name and also your tutorial group after you have completed these questions, and your attendance will be taken. Thank you and all the best.